Good morning, everyone. I am delighted to welcome you all today. My name is Dr. S. Virgin-Jeba, and I am an assistant professor of physics at Holy Cross College, Nagercoil. Today, we will be exploring an interesting topic, ear pressure. Over the course of this presentation, we'll look into what causes ear pressure, how it affects us, and some ways to manage it. So let's get started and discover more about this fascinating subject together. Let's talk about ear pressure. It's often described as a feeling of fullness, like your ears are clogged, or even as if you're underwater. This sensation mainly comes down to how air pressure is regulated inside the middle ear. Unlike the constant fluid pressure we experience in our eyes or the physical weight our feet bear, ear pressure is usually temporary. It happens because of changes in the environment, like altitude shifts, or internal blockages that affect how air moves in the ear. Understanding this helps us see how ear pressure differs from other types of pressure our bodies experience daily. It's a key piece of the overall picture of ear health and how our bodies adapt to different conditions. Let's take a closer look at the mechanics behind ear pressure, focusing on the eustachian tube. This small canal plays a crucial role because it connects your middle ear to the back of your throat. Think of it as a pressure equalization valve. Under normal circumstances, it stays closed, but it opens up when you swallow, yawn, or chew, actions that help regulate pressure. Now, for your eardrum to vibrate properly and let you hear clearly, the air pressure inside your middle ear needs to match the atmospheric pressure outside. If the eustachian tube becomes blocked or swollen, things get disrupted. This can cause a vacuum or negative pressure, which pulls the eardrum inward, or a buildup of pressure, known as positive pressure, which pushes the eardrum outward. Both situations lead to stretching of the eardrum and can be quite uncomfortable. Understanding this mechanism helps us see how crucial the eustachian tube is in maintaining ear health and proper hearing function, especially when we're experiencing changes in altitude or during colds. Let's take a closer look at some common causes of ear pressure issues. First, altitude changes are a frequent culprit. When you're flying, diving, or driving through mountainous areas, the rapid changes in altitude can outpace your ear's ability to equalize pressure through the eustachian tube. This quick shift can create that uncomfortable feeling of fullness or pressure in the ear. Next, eustachian tube dysfunction, or ETD, often occurs when the tube that normally helps balance pressure becomes inflamed. This inflammation can stem from allergies, colds, or the flu, which cause swelling and prevent the tube from opening properly. When that happens, air can't flow freely, and pressure builds up. Another common cause is fluid buildup behind the eardrum, known as otitis media. Infections can cause fluid to accumulate and trap behind the eardrum, leading to persistent pressure and sometimes pain. This is especially common in children, but can affect adults too. Earwax impaction is also worth mentioning. Sometimes, a physical plug of wax can block the ear canal, creating external pressure. While it might seem simple, this blockage can significantly affect how you perceive pressure or sound. Finally, there's Meniere's disease, which is a bit rarer. It's an inner ear disorder characterized by a buildup of endolymph fluid. This buildup causes episodes of pressure, dizziness, and ringing in the ears. Understanding these causes helps us see how various factors can influence ear health and pressure regulation. Let's talk about some common symptoms of ear pressure that you might experience. First, you may feel a sensation of oral fullness, which is like your ear feels plugged or heavy, almost as if there's a blockage. This can be quite uncomfortable and often signals that something is affecting your ear's pressure balance. Next, you might notice muffled hearing. Sounds can seem distant or like you're hearing through a tunnel. That's because the pressure change affects how sound waves reach your eardrum. You could also experience popping or crackling sounds. This happens when your eustachian tube tries to open to equalize pressure, but struggles or fails temporarily, creating those familiar sounds. Another interesting symptom is autophony, where you hear your own voice or breathing very loudly inside your head. It can be quite startling and is a sign that pressure changes are impacting your inner ear and surrounding structures. Lastly, if the pressure difference becomes severe enough, you may experience ear pain or otalgia. This is usually a sharp pain caused by the eardrum stretching or being pulled due to the pressure imbalance. Understanding these symptoms helps us recognize when ear pressure issues are at play and highlights how interconnected these sensations are with our overall ear health. Now, let's talk about some simple techniques to relieve ear pressure. Most cases can be resolved with easy skills that help open the eustachian tube. One of the most common methods is the Valsalva maneuver. To do this, pinch your nose, close your mouth, and gently try to blow air out of your nose. But be careful, blowing too hard can actually damage your eardrum, so gentle is key. Another effective technique is the Toynbee maneuver. Here, you pinch your nose and take a few sips of water. This helps to equalize the pressure in your ears gradually. Physical movements can also make a big difference. Yawning widely or chewing gum stimulates the muscles around the eustachian tube, encouraging it to open and equalize pressure naturally. And if your ear pressure is caused by a cold or allergy, decongestants like nasal sprays or oral medications can reduce swelling around the tube's opening, making it easier for air to pass through. These simple methods are often enough to relieve discomfort and restore normal ear function, which ties back to our overall theme of managing ear health effectively.